Hi, I'm Libby from NJACP, and I'm here with Assemblywoman Carol Murphy,
Hello.
a wonderful friend to our community, a huge champion, chair of the Assembly Health Committee, vice chair of the Children's, Family, and Food and Security Committee,
Yeah.
a member of the Budget Committee,
That's right.
and a member of the Assembly Preparedness,
Public safety and preparedness.
Public Safety and Preparedness.
Yes.
So you really do span about every issue
I have
that the
no other life other than this.
The Assemblywoman is also a member of the founding member of the Disability Caucus.
That's right. Yeah.
And I want to thank you so much for being here. And before we get started, I really want to just start by thanking you for being the sponsor of our budget resolution this year,
my God, thank
providing
you.
for increased funding for providers so that they can best serve the individuals that they support. So thank you for being such a champion for
Thank you.
individuals. So
Thank you.
share, I'd love to hear how you sort of stepped into this space and why you have stepped into this space of leadership.
So thank you. At first, I want to say thank you. It's extremely important to me that you have your not only Maureen and yourself, and when Ginny was here, along with all my other friends and disabilities, have invited me into their family. And that is why I try so hard to fight for what we need to get done here, because this is an extraordinary family that you can't find anywhere, right? I mean, they may have a different normal than what we are, but it's all about being together. And I appreciate your trust and you're inviting me into helping out, and it makes me feel good to be able to say, yes, I can help. But you know what? How I got involved in this space, it was when I first got elected. Actually, before I got elected, I worked in government, and I worked for schools as well. And folks with disabilities were just, at that time, I hate to say it this way, but were just, I wouldn't say obsolete, but they were kind of forgotten about.
Not seen.
Yeah, not seen, not paid attention to, because people were afraid to. And I think that's where this came from. So when I became an elected official, one of the things that I did go and start getting involved is I went and visited and toured an independent living council place. Found it truly, and one of the gentlemen who worked there, he lives in my neighborhood or in my town, and very inviting. But you know what? You start realizing as you navigate through this, it's a great feeling, because they're people who want to be successful. They want to work.
Absolutely.
They want to have families. They want to live independently. They want to have the same access to services that we have. It's just different. It's not any bad. It's not any good. And I think they get misunderstood, or I should say the policies and their whole environment get misunderstood, because we have for so long labeled them under one label, and we have to get away from that. And I think over the last 8 years that I've been in office, we've seen a lot of legislators grow into the fact that this is all not just one label for our folks with disabilities. They are human, and they deserve the same rights that we do. So I'm here because I think it's important for me to say that I am here to support and to work as hard as I can to bring out their independence.
Well, I so appreciate that. I stepped into this role about a year ago, and I have learned so much being in this, going out and visiting my members, visiting the individuals, talking to families, and understanding really what a complex system this is. And I think that's something here, certainly at NJACP, that we need to continue to focus on. How can we ensure that individuals are getting the services that they need, or getting the support that they need? And I appreciate all the work that you do in the legislature as a partner in making that happen. And certainly funding is a big piece of that.
Absolutely.
And I know that this is a really challenging budget year. Obviously, the implementation, Medicaid cuts coming down from the federal government, and while the IDD community is not the intended target, anytime Medicaid dollars are shrunk, of course there is an impact. So there is this growing need in the community for services, and this threat of funding. And I just appreciate you stepping up and saying, no, we need to continue to invest in this system because the need is there. And I worry about the long-term sustainability of the system because there is no sort of long-term plan.
That's right.
So can you talk a little bit about the budget and where things might be? And I know these are the critical 2 weeks.
Well, first of all, I want to make a comment on what you said. It's important to realize that I started working with you guys and start advocating for wages for our workers for a lot of reasons, but mostly because my friends with disabilities, my families with disabilities, my colleagues with disabilities, they depend on our care workers.
Yes.
They trust them. It isn't like you can just hire one tomorrow and everything will be good. These are folks who come into our friends' lives and they actually make a difference. But more importantly, they build the trust that is needed to give them the security to continue advancing. And I think that's why this is so important. And when we see some of our workers say, you know what, I could either go to a grocery store and get this amount of money, or I could stay here and exert myself for this amount of money. Which do I want to do?
Right.
And we have to make sure that there's competitive wages to continuously make sure our workforce is there. And as the health chair, that's one of the issues that I am looking into is workforce on so many levels. But with the budget itself, we did put in the resolutions. We're waiting for negotiations to happen, whenever that shall be. I'm hopeful that next week we'll see a budget committee hearing, at least a meeting. I'm hopeful. We do have a Caicos Day on Monday, but if that doesn't go on Monday, the schedule changes every day, and we have until June 30th at midnight, which could last 2 weeks if we had to.
Time is a little bit different in Trenton.
Exactly. And let me tell you, when it gets to be midnight or 11:59, that clock is ticking. And I'm very hopeful, that the governor, while she is a supporter of folks with disabilities and all that, we are able to sustain what we have going on because so many programs are being cut for so many different reasons. And I just don't want those that are necessity, such as my folks' resources for disabilities, get cut. We've worked very hard over the last 8 years to get the attention and get that funding that we need, and including any increases that Governor Murphy at the time had made. And the 3% COLA is also another issue that has to be taken into consideration. These are hardworking folks who are here not because it's a job, but because it's something they care about, a passion. So with the budget, and I have to tell you, over the last years, and Libby, you probably know this, is that every time we're in budget and I start talking about my folks with disabilities, they say, yeah, okay, just give her what she wants and let her quiet down for a while. Because there is no bigger supporter than I am with my folks with disabilities.
Well, and I know that, and I think that is just so important to have someone in a leadership role like yourself being that champion in the room and standing up. Certainly the Senate president many years ago, Senator Steve Sweeney, he was a great champion. That is something that we desperately need and appreciate your stepping into that role, because we know there are so many competing issues and interests, but this community is different than some of the perhaps projects that have been funded, which also are very important. I'm not saying that, but I do worry about the long-term sustainability of the community-based system that enables individuals to live the lives that we all want.
That's right.
And so your understanding and appreciative of that is something that we at NJACP are grateful for.
Thank you.
And your leadership, being on the budget committee, and your background in health, and all the other things that you
can tell I'm much of a life, but it's all work.
And I would say too, right? Because there are really no disability issues. They're all disabilities.
That's
when
right.
you talk about safety
exactly.
and preparedness, that's a disability issue.
That's right.
Because we're all humans.
That's right.
So
we all have a crutch. We all have faults. We all have something we lean on or fears. And it doesn't matter whether it's intellectual, physical, emotional, we all suffer from them. And we have to stop putting labels on our folks and start looking at those necessities. And, Steve Sweeney was a colleague of mine that I worked very closely with on the disabilities, especially on the workability bills and things like that. And, one of my constituents who is disabled wrote 2 books on advocating for disabled. And I was very fortunate to actually write the foreword for him, which was very honored for me to do that. And so when my folks ask me to do something, I take it very seriously, and I take pride in the fact that I'm sitting here today talking with you, not because I want a pat on the back, but because I want to explain to people that why it's so important for us to pay attention.
I think that's a perfect place to leave it there. And I want to just thank you. Thank you for being a voice for the individuals that our members have the privilege to represent. And thank you for being a friend to us in the legislature. And thank you for being a great champion. And
Absolutely.
I wish you all the best in the next 2 weeks. And hopefully get some rest this summer.
Yeah, it is 2 weeks. I keep thinking a week because it's towards the end of the month already.
Maybe a week and a half, 13 days, I think it is
I think
exactly.
we're going to last for a while here. But we're all good. And Libby, thank you so much for doing this, because you know what? We've been working together for a very long time, and I see you thriving in this role. I see this as a role that naturally fits for you and naturally fits for the organization, as well as all of our friends and families and disabilities. So thank you for doing this.
That means a lot coming from you. Thank you so much.